Here's something that will shock you. What if the only warning your body gives you before a heart attack, stroke, or organ failure is a strange sound you barely notice? Did you know that studies reveal a staggering number of serious health conditions? Particularly heart and brain diseases often begin with subtle, strange signs that most people dismiss completely? It's terrifying but true. In many of these cases, the first and only warning their body gave them was a sound. No pain, no swelling, no visible symptoms, just an unusual noise that most people brushed off as nothing. But here's the truth. Your body doesn't make strange sounds for no reason, especially after the age of 60, when your organs, joints, and nerves have experienced decades of wear and tear. These sounds can be your first and final warning before something life-altering happens, like a stroke, a heart attack, or even total kidney shutdown. The science is clear. Paying attention can make the difference between timely intervention and a devastating outcome. So in this video, we're revealing the top 3 body sounds you should never ignore after age 60. You'll learn exactly what each sound means, how to recognize it when it happens, and when it might signal something life-threatening. And trust me, you'll want to stick around until the end, because the number 1 sound is something most people have heard at least once and had no idea it could be a red flag for an emergency. Plus, we'll also reveal a very powerful natural drink you can start sipping today that has been shown to boost blood flow to the brain and even lower your risk of strokes and aneurysms. It's simple, affordable, and surprisingly delicious. Before we begin, let us know in the comments below where you're watching from, and don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's get started. Number 3. Sound number 3. Wheezing while resting or during minor exertion. Wheezing is that high-pitched whistling or rattling sound that typically happens when you breathe, usually more noticeable when you're breathing out or exhaling, but sometimes audible when inhaling too. For many people, this sound might seem like nothing more than an inconvenience, but respiratory doctors identify this as one of the most overlooked warning signs in older adults. When you breathe, air should move silently through your airways. Any audible sound means something is partially blocking that natural flow. Now, some people might experience temporary wheezing during a bad cold or bronchitis, often accompanied by coughing and mucus. However, when it is happening at rest or with minimal effort, especially if it's a new or worsening symptom after age 60, it is a significant warning sign that requires prompt medical attention. A high-pitched wheeze, particularly when resting, often signals that smaller airways are narrowed or partially blocked, typically from conditions like asthma or chronic obstructive pulmonary disease, COPD. What makes this particularly relevant after 60 is that many people develop late-onset asthma, mistakenly believing that asthma only begins in childhood. These are the common causes. However, the sound you should pay particular attention to is wheezing that occurs primarily when lying down or that wakes you from sleep. This pattern frequently indicates heart failure rather than lung disease, as fluid accumulates in the lungs when horizontal. So, how can you distinguish normal breathing changes from concerning ones? Well, you need to pay attention to the context. Temporary wheezing during a respiratory infection is usually less concerning than persistent sounds that occur during normal activities or at rest. A simple test you can do is if you can't carry on a normal conversation without pausing to catch your breath. Your breathing sounds need medical evaluation. Equally important is recognizing that new breathing sounds that appear with exertion, but weren't present before suggest your cardiovascular system is struggling to meet oxygen demands. The timing of these sounds matters tremendously. Morning respiratory noises that clear after being upright for an hour often indicate chronic sinus drainage or reflux, while sounds that worsen throughout the day may signal inflammatory conditions that respond to triggers encountered during daily activities. What surprises many here is that breathing sounds don't always originate in the lungs. A surprising number begin in the throat or upper airways, where age-related muscle changes can cause tissues to vibrate or partially collapse during breathing. If you've been attributing your breathing sounds to just getting older, consider that. While aging does affect respiratory function, audible breathing almost always indicates something is wrong on the inside. Number 2, a sudden ringing sound, buzzing or hissing in your ears. Let's talk about something almost everyone over 60 has experienced at least once. That sudden high-pitched ringing in your ears that seems to come out of nowhere. It might last for a few seconds or linger for minutes, and most people brush it off like it's nothing. But that sound, called tinnitus, can be a sign of something much more serious than just getting older. First of all, tinnitus isn't a disease itself, it's a symptom, and what it's pointing to could range from minor to absolutely critical. At its most harmless, it can be caused by age-related hearing loss, exposure to loud noises over the years, or a buildup of earwax. But in some cases, especially if it comes on suddenly and only in one ear, it can be a warning of vascular issues such as high blood pressure or even an aneurysm. Here's how it works. When blood vessels near your inner ear aren't functioning properly, they can create turbulent blood flow, which your ear perceives as sound. This is known as pulsatile tinnitus, and it often matches the rhythm of your heartbeat. If you ever hear a rhythmic pulsing or whooshing sound in your ears, stop what you're doing and pay attention. That sound could be your body warning you about a serious cardiovascular problem like carotid artery disease, or even an impending stroke. Other times, tinnitus is a red flag for nerve damage in the auditory pathway. This can happen when the delicate nerves in your inner ear, called the cochlear nerves, start to deteriorate. It's often one of the first signs of sensorineural hearing loss, which is permanent and gets worse over time. The emotional toll of tinnitus shouldn't be underestimated either. When it becomes chronic, that constant ringing can cause sleep problems, anxiety, and even depression. Many older adults suffer silently with this, not realizing there are treatments like sound therapy, cognitive behavioral therapy, and even medications that can help. One of the most dangerous things about tinnitus is how normalized it's become. People over 60 often assume it's just part of aging and ignore it, which delays the diagnosis of underlying issues that could be caught early. If the sound comes with dizziness, a sense of fullness in the ear, or balance problems, it could also be part of Meniere's disease, which is a disorder of the inner ear that can severely affect your quality of life. And sometimes, the sound isn't coming from your ears at all, but from a small benign tumor on the auditory nerve called an acoustic neuroma. It starts small, but can press on nearby structures, causing not just hearing problems, but eventually facial numbness and difficulty swallowing. That's why it's critical to track the pattern. When does the sound happen? How long does it last? Is it in one ear or both? These clues can help your doctor uncover the real cause. Never chalk it up to just noise, because that noise might be your body's only cry for help. Sound number 1. A sudden loud whoosh or popping sound in your head, followed by silence or pressure. Now let's talk about the most critical and terrifying sound your body can make after 60. It's not always painful, but it can be unforgettable. A sudden loud pop, crack, or even a fast whoosh sound that seems to come from inside your head sometimes, followed by a moment of silence, intense pressure, or even a fuzzy sensation. Many people describe it as if something suddenly shifted or burst inside their skull. What makes this sound so scary is not just the noise itself, but what it might signal. In many cases, this is not just a random nerve twitch or something you can ignore. This internal sound could be the first sign of something far more dangerous, like a mini-stroke, transient ischemic attack, a brain aneurysm, or a sudden spike in intracranial pressure. Let us explain how. As we age, the blood vessels in our brains can become weaker and more prone to abnormalities. Aneurysms, which are balloon-like bulges in blood vessels, often form silently over many years, and they can be common. If one of these weak spots starts to leak or suddenly bursts, the very first thing a person may notice is a sudden internal pop or whooshing sound caused by the rush of blood escaping into the surrounding tissues. The sound might last only a second or two, but what follows can be just as telling. Confusion, a strange pressure in the head, double vision, or even a sensation that one side of your face feels different. But here's the catch. In the earliest stages, there might be no pain at all, only that sudden internal sound. That's why it gets ignored. Even more dangerously, some people will write it off as a weird inner ear problem or think maybe their jaw cracked or they slept in the wrong position. But if this sound is accompanied by any neurological symptoms, like vision changes, difficulty speaking, sudden weakness, or dizziness, it's an emergency. This could mean a ruptured aneurysm, a minor hemorrhage, or a silent stroke, and those aren't just scary words. They are life-threatening events that require immediate action. Even if the cause isn't a full-blown aneurysm, a sudden pressure shift in the brain can be linked to hypertension spikes. High blood pressure, especially in seniors, can cause blood vessels to constrict so rapidly that it creates a physical shift in the flow of blood, sometimes creating a sound that feels like it comes from inside the skull. People often report it when standing up quickly, bending over, or turning their head rapidly. In rare but serious cases, that popping sensation could also come from an arterial dissection, where the inner lining of a blood vessel actually tears slightly. This is more common than most people think and can lead to strokes or blood clots, especially in people with a history of smoking, cholesterol issues, or uncontrolled blood pressure. What's tricky is that this sound can sometimes be confused with the normal noises your jaw or eustachian tubes make, especially if you have sinus congestion or TMJ disorder. But here's how you know it's different. This sound often comes with the sense that something deeper has shifted inside your head. More internal just happened. It doesn't feel like it came from your ears or jaw. It feels like it came from inside, your brain. If that's ever happened to you, even once, don't dismiss it. Tell your doctor, even if it was a one-time thing, especially if you're over 60. Doctors may recommend a brain MRI, CT scan, or vascular imaging to rule out silent aneurysms or early signs of stroke risk. And yes, it's scary, but catching these signs early can literally be the difference between catching it early or a disastrous outcome. People who recognize these warning sounds early and get tested often catch things in time to prevent major irreversible damage. So, if you've ever heard a loud pop in your head, followed by a weird pressure wave or fuzzy sensation, don't just brush it off. It might not be anything at all, but it could be the most important warning your body ever gives you. After age 60, your body becomes more talkative than ever. It's constantly sending you little messages, but the trick is knowing which ones matter and which ones don't. Sounds that seem harmless, like a quiet ring in the ears, a faint crackle in the chest, or a brief pop in the head, can sometimes carry enormous meaning. And the scariest part? You won't always feel pain. You might not feel sick. These sounds are often the first and only sign that something is seriously wrong. But the good news is, now you know what to listen for. The next time you hear a sound in your body that doesn't feel right, don't ignore it. Notice the patterns and take action if it keeps coming back or feels alarming. Best drink to prevent. This now, as promised, let's talk about the powerful drink that could quietly transform your brain health and circulation. Beetroot juice. This isn't just some trendy wellness fad. There's powerful science behind it. Beets are naturally rich in dietary nitrates, which your body converts into nitric oxide, a molecule that helps relax and widen blood vessels. That means better blood flow, especially to critical areas like your brain. In fact, a study published in the journal Nitric Oxide found that older adults who drank beetroot juice daily had increased blood flow to the frontal lobes of the brain, the region responsible for memory, focus, and decision-making. This improved circulation may even help delay or reduce the risk of cognitive decline, stroke, and vascular dementia. To prepare it at home, just wash and peel 1 to 2 medium-sized beets, chop them into small pieces, and blend them with a cup of water or apple juice. For added sweetness, you can also squeeze in some lemon juice or add a tiny piece of ginger for flavor and even more anti-inflammatory benefits. For best results, drink it in the morning on an empty stomach 3 to 4 times a week. Just 1 glass can start supporting healthier arteries and brain function within hours. And here's a pro tip. If you find raw beet juice too strong, you can lightly steam the beets first. It slightly reduces the nitrate content, but makes it easier on the stomach while still delivering great results. It's an easy, delicious way to protect your brain. Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.